So we're diving into the vital topic of sports injury management. Recent events like the Olympics have shown us just how far athletes push their bodies, highlighting the need for effective injury prevention and treatment. And with us is registered physical therapist, Chaz-Anthony James, who will offer expert insights into both treating and preventing sports-related injuries. He'll also discuss the essential role of collaboration between physical therapists, coaches, and physicians, and share strategies to help athletes recover swiftly and to their peak performance.
Good morning.
And that's important. As an older person, there was a time when you had an ankle injury and you're out for the season. Mm-hmm. Now you're back in days.
Yeah, days to a few weeks.
Yeah, and as I said, in days. I can remember there was an American football quarterback, Ben Roethlisberger, who took out his appendix and played 3 weeks later.
Yeah.
So things have improved.
For sure.
I guess it depends on the sport, but usually it's the hamstring and the groin area and the ankle that we see most. Mm-hmm. Why is that? Is that because we're not warming up properly, we don't stretch properly? Why is that?
Yes, so we do see a lot of muscular injuries, and it is a lot to do with warm-up, a lot to do with strength training, mobility. A lot of that isn't necessarily done as extensively as it should. Yeah, so when we get to increasing intensity, like that pre-competition stage, when you're really pushing the athletes, then those tend to show up a lot.
Yeah. And those are the most frequent injuries that you'll see?
Yeah, we see a lot of hamstring, we see a lot of knee, in general population, but also athletes, the Achilles, back as well. So those really show their face.
It has anything to do with, and you kind of mentioned it already, to the way we coach, the way we train, because some of us not kind of au fait with sports medicine. I mean, we can't tell them how to kick a football and how to save a goal, but we don't know if to tell them how to warm up and stretch.
Yeah, that does have a part to play, but in truth, I wouldn't attribute it solely to that, because sports medicine journals show that 2 in 3 athletes get an injury for the year. Yeah. As for our Olympians, unfortunately, that injury came around in the peak season, you know. But the training method, the training regimen can contribute to it, because if it's a case where there's not adequate rest, sleep, we know a lot of our, well, maybe not the elite athletes, but our high school athletes with the schoolwork that they're trying to complete, next day, training and a match, you know, that stuff can play a part as well.
A lot of people, when they think about therapy, they think about correcting something. Can therapy help you to prevent injuries?
Yeah. Prevention, also through correction, though, correcting the way you complete certain movements. Plenty of times in the clinic, I ask a patient to show me a squat, and it may not be the cleanest movement, but that's something that you can work on, because the way you do certain things, for example, put stress on certain structures that shouldn't be loaded that much. So like you ask someone to bend down, they bend from the back, just like that, as opposed to bending from the hips. Stuff like that can, over time, lead to pain and disability. You know?
Okay.
There was a time when I heard that the physio, or the physical therapist, you can't diagnose. So you would send me to a doctor, and then the doctor say you need to see a physio. Has that changed?
In terms of our skill sets, we are able to diagnose. Legally, however, we do have direct access in the sense that our patients do still have to see a medical practitioner before they come to us. But nonetheless, we do our own assessment. We do identify, regardless of the referral, we do need to see what is going on with you as an individual, regardless of what may have been said before, you know, and that helps us to plan our rehabilitation for you.
When you said legally, you are not allowed to do that?
Yeah, so it should be a medical referral and then to the physical therapist.
So it's a suggestion that if I feel a little hamstring thing, I can't come to Chaz, so I have to go doctor first?
Yeah, but that's something we're trying to change as a physical therapy fraternity. We're working towards allowing our patients to come straight to us, because other Caribbean islands can do it as well.
Wow.
I don't want to belabor the point, but what if I come to you first? Are you going to tell me that you cannot treat me?
We do emphasize the need for the referral, yeah. But nonetheless, we do have in-house doctors, so you can then see them and then come to us.
And then come to you. Are there specialist physiotherapy? I'm going to explain what I mean, because I know there's physiotherapy in general, but do you have physical therapists who specialize in track, those who specialize in basketball, those who specialize in
I get what you're asking. Sports specific, no, but sports in general, yeah, because you have different facets. So you have geriatric physiotherapy, deal with elderly, but sports, once you do specialize in sports, it does cover that realm, regardless of the sport you're in.
Yeah, and even though we're talking about sport, you guys treat pneumonia and all kind of
Everything
stuff.
under the sun. You see our stroke patients, pneumonia, post-COVID patients. Yeah, so physical therapy is vast. Musculoskeletal, cardiopulmonary, everything.
Why did you become a physical therapist in the first
Well,
place?
I have an extensive sporting background. High school, prep school, I played cricket, basketball, football. Even now, I do those stuff. And I love sports. But then I also realized that I love helping people, working with people on that continuum, on that process of getting better.
Yeah.
So I just merge the two of them.
Why is it important for the physical therapist to be a part of an overall plan for an athlete? Like, you're not doing something and then the coach doing something else and
Yeah.
the athlete doing something else, that you're all in tandem.
Yeah, so at the forefront of it, the athlete is the most important person. It's their well-being, of taking care of them, but the coach spends a lot of time with them. And for example, the coach, there's an injury, it's important that we are able to tell the coach, okay, let's ease back on a particular bit now, and then we reintegrate the athlete at a certain point. Without that collaboration, then sometimes the athlete is then at risk.
How important is the massage therapist? I see these athletes, and this is true, by the way, they get a massage before they train and then get one after them train. What's the benefit of that?
Yeah, so it is beneficial as it promotes blood flow to the tissues, gets them kind of primed for movement, and that in itself can help to reduce injury. The massage therapy is different from the physical therapist, just the same, but their role is imperative in that pre and post care to make sure the athletes are ready, especially like we see in the Olympics, they have the semi-finals 2 hours before the finals. They have to prepare the muscles for that,
Yeah. I've already said at the top that some injuries now, you're back on the field in a couple of days. I suspect it would be the type of injury, so you can't just say, well, do you have a bad knee? Come on, I can get you ready in a day or two.
Yeah.
It will depend on what the injury is, right?
So our assessment tells us that, so you go through certain structures take longer times to heal, muscles do a bit better than your ligaments, joints. So we know that, okay, there's an expected period of time and we can let you know that, and we set goals based on what you like to achieve to get you there.
Yeah. What advice would you give to athletes in terms of, I know you can't prevent injury, definitely, but minimizing. One of the things I heard you say was in terms of the warm-up.
Yeah.
What are some of the other things that an athlete can observe?
Yeah, so I know, unfortunately, our Jamaican populace, we hate stretching. That's one thing, you ask a man to stretch, he would never do it. But it is very important, stretching, mobility work, and strength training, particularly for muscular injuries. We do what we like to call eccentric strength training. So if you see someone in the gym, a lot of times they're doing bicep curls like this, the muscles getting shortened, or your knee extensions, the quads here getting shortened. So we work them the opposite way. Lengthen them throughout the range of motion with strength or with load, and then they respond well to it, because it is in those lengthened positions where the muscle is most vulnerable.
Tell me that again.
So it's in the lengthened position. So for example, your hamstring injuries, when you're doing your high-speed running and you have to extend the knee and it gets on that stretch and that tension, that's when it's most vulnerable. So you strengthen in that fashion.
Okay. Wow. And that's
Makes sense.
Yeah, and that's also a part of treatment. Also, is how you because and there was a kid down the school that he had a bad left leg, and it was for a while. But when him come back, the right leg did gone because him kind of never balance out the
Yeah.
So how you stop that though?
So you stop that by assessing in the initial bit. So you notice when you do the movement assessment, we're able to assess biomechanics. That's how the body moves through space, right? So you notice that, okay, you ask him to do a squat, for example, a jump, they're putting more pressure through one side. Then you say, oh, do you have an injury history on this side? Was there any pain on this side prior? And then from there, you tailor exercises to then, improve that.
Yeah, man. All right. Thank you, sir.
As you know, yeah, talk
Pleasure,
more.
my pleasure.
Yeah. But she need you also one, She have a bad knee, was about 14 years.
Patient confidentiality, man. You can't air around like that.
No, I can't boss it.
Never. I said to somebody the other day that if I knew playing netball and basketball and volleyball on concrete and asphalt would be the result of the knee,
Yep.
Pack it up a long time.
but I got play marble.
Yep. But I want to tell you, even our football surfaces, they are so tough
Yeah.
that it depends on even the studs that you have.
Yeah.
It mash up.
Yeah.
It mash up.
Yeah.
There's a club that every time they have training, they actually just wet the field. They kind of soak the field. So
Kind of tough.
no man, we've grown them tough. Thanks, Bridget.
Thank you, my pleasure.
Yeah, man,
My
keep
pleasure.
on doing what you're doing.
Registered physical therapist Chaz-Anthony James.
So when we come back, we get the details of Grenada's driving school's road safety 5K. Soon come. Stay with us, please.